The next session is going to be moderated by Les Becker. If you guys want to come up, they'll be discussing the Washington Health Situational Awareness for Novel Epidemic Response.
Good morning, everyone. So thank you for being here. We have a session for you today around what we call WA Health. If you have been catching the themes, we like to put WA in front of everything we do in Washington. So this is WA Health, and you heard about WA Verify, and you heard about WA Notify. But I want to draw some corollaries as we start talking about what we're doing this work around. And so the theme today is really about partnership, working with industry partners, working with academic partners, working with our other partners even within the agency. So we just had a great panel on data modernization, and it would be remiss of me if I didn't recognize Cynthia Harry, who is here from Tal Quanget's team, who is the other half of our internal team for data and data modernization. So Cynthia, if you would stand up. I know everybody hates that, but Cynthia Harry. And so internally, our job is to get all that data prepped, ready, consolidated for her so her team can do really great analytics and make health decisions that impact our community at the end of the day. And that wouldn't be possible without the UW work, it wouldn't be possible without my team, and it wouldn't be possible without Cynthia's team. So that's the way these things all work together. And when you add industry and our private sector partners that can come in and just accelerate that, then you get really tremendous growth and tremendous responses. And we did this during the pandemic. And so I want to correlate the themes for you today because I really want you to pay attention as you go through the sessions this morning, which are really about the past and what we did and how we did it and what we learned from that and what we think that you can hear and learn from that. And then we'll transition to the afternoon where we'll kind of talk about what the future looks like and how do we keep that going and how do we find some other ways to jumpstart and to move into the 21st or 22nd or 23rd century using these same kind of ideas. And it is about that workforce development. It is about partnerships. It's also about leveraging the investment. So our federal partners, our state, our community invested a lot in public health during the pandemic. To use one of my boss's favorite quotes is, shame on us if we don't leverage that investment moving forward and make a reality out of the minimal viable products that we created that worked so well during the pandemic. It will be a waste and a shame, and the country will be worse off if we don't do that work moving forward and really leverage that. And I think WA Health is a great example of that. I think WA Verify is a great example of that. I think WA Notify is a great example of that. But there are others, and we need to keep that momentum going. It's going to take funding. It's going to take resources. It's going to take commitments by all of you in this room to come up, show up. How do we vision going forward? How do we see us working together? How do we knock down those contractual barriers? Dr. Zink said there's a lot of restrictions on us, and that's true. But we can be creative, and we can work through them. We ask for patience from your side, from the public, from the private sector, and we ask our public sector partners to be a little more open to doing things in a little bit different way. So I want to set that theme for you as we transition into this discussion, and I'll first do an introduction, and then I'm going to show you a short video about partnerships, and then we'll get a little further into the details. So first, we have Sheridan Jones from Microsoft, and she's head of strategy and project management for Microsoft Research. And it's such a privilege to have her on the stage, so welcome, Sheridan.
Thank you.
And we have Ravi, who is on my team within the Office of Innovation and Technology, and he's one of our lead architects around HL7. So these two players played a pivotal role in the development of our WA Health platform. But as we get into this and we talk about what WA Health is and how we can talk about workforce development, partnerships, leveraging those COVID dollars moving forward, I want to share a quick video with you about the overall theme of how we did this during the pandemic to give you a kind of a base of what we do. So I don't actually know how to start the video, so I'm going to ask.
Magic.
Difficult challenges and problems, and just in time, right as those challenges are being identified, has had to come up with solutions. And the way to come up with those solutions has not just been singularly about Department of Health, but it's been about our private partners.
So in January, I actually got a call from the governor's office asking if I'd be interested in heading up this new center called the VAC Center, which was an effort to bring the private sector to partner with the state of Washington Department of Health to mass vaccinate the state of Washington. There was a shortage of vaccines, and the state had to ramp up very quickly how to respond. And literally, people were spending days and And so we needed to figure out how to get information out quickly, how to make the vaccines available in an easy to reach way that was equitable.
And that was where the vaccine locator app was born. Last time I checked, it's been used by over 3 million Washingtonians. It never crashed, it never failed. And so, it speaks to the team, the expertise that we got from Microsoft that helped us build something that was ready for that level of use and scale and demand.
Microsoft created another dashboard for the vaccine ordering and distribution. It was able to have every provider that was enrolled in the program, the number of times vaccines are moved from one provider to another, and it gave us an equitable way to distribute it. And this was a dashboard that was used internally at DOH as well as our partners, our local health departments. So they were able to see our 4-week forecast, which is part of how we supported distribution of vaccines. We would get a forecast from the CDC. Also, it gave us real-time ability to answer media inquiries as well as inquiries from the governor's office. It truly helped us see a full picture and our local health partners see that picture as well to support vaccine ordering. So we're almost at our 1-year mark, coming December, of vaccine being distributed in Washington State. And it's been a long road to get us here, and a lot of late nights, early mornings, and just teamwork.
I think the state has an enormous opportunity now to drive public health education. We really are at a moment in time where we can distribute that education pervasively across the state, 100%, which then lists the status of our health as a society in the state, which I think is a super, super exciting moment.
I think this is now a great blueprint for how you bring all sectors to bear on a massive problem.
We had to learn on the fly. And now that we're there and we are in that environment and we are releasing systems in the cloud and we are leveraging things like Azure DevOps and things like the Power Platform, moving to the cloud has helped us build in that scalability and help our systems be able to handle that load.
We can't rest on our laurels. We have to constantly be looking for ways to improve our processes, to train our people, and look to the future, to think about what we have learned, what we have done, and build a better future tomorrow. And that's transformational health. And I'm hopeful that that is what we're going to be able to learn from this pandemic.
Okay, I'll figure the technology out here in a second. But I like to show you that video because you'll hear about WA Health, WA Notify, WA Verify. Those are all great, got great names. WA's in front of them. There was a lot of work that happened. A lot of partners came to the table. And it was because there was a community at risk. There were family members at risk. Everyone was in the fight in one direction. But that doesn't go away when COVID goes away. It's still here. The next pandemic is around the corner. The next virus that hits us, the next disaster that happens, public health plays a role in that. And that's why it's so important that academic, local partnerships with local health jurisdictions, state departments, private entities, they all come together to fight the fight. And the fight can continue to evolve and change. And this is a catalyst moment for us. This was a catalyst moment for us to look at hospital systems and how public health looks into that hospital system and says, what's happening? How can we keep a community informed? How can we help you with resources? How can we make the experience of what's happening in that hospital better for our community? And the tool that we developed that with was called WA Health. And it's really a surveillance system at the end of the day. It allowed us to see what was going on with bed occupancy, what was going on with staffing, equipment, supplies, COVID tests, COVID vaccinations. And that's imperative for the health agency as a response organization to know that information and help drive resources into the right place around the state as the virus shifted and moved around and morphed and danced and whatever it did. And that can happen within any disaster, but certainly within COVID, those shifts and different variants came out which required different responses. real-time information happen. So that partnership on the hospital side is critical, but it's very labor intensive. And part of what Microsoft and Ravi and his team brought was automation to that. How do we coalesce that data? How do we ingest it? How do we make it usable for decision-making purposes by the people that were in the middle of the response at the time? So I won't bore you with what it does, because basically it's situational awareness. It helps us understand what's happening in the community. It helps us derive resources. It helps us make better decisions. At the end of the day, we needed to have good governance on that. You've heard that when we talked about WA Notify and WA Verify. Having community input into these decisions about what technology we're using and how we're using it is critical to have the confidence for the citizens to be able to use it and to be able to want that to last into the future. And in this case, the hospital systems had to come to the table and provide their input and understanding of the situation. So from a governance standpoint, what I'd put out is hospitals were our partners in this, but they were also part of the people that helped us govern how we implemented this technology and how we used it into the future. Some examples of the slides and graphs that we used during the pandemic to make these decisions, to have the conversations, but at the end of the day, we have to find the post-pandemic strategy and direction for this. As I said, huge investment in technology, but this is just one pandemic. COVID actually isn't gone away, so there's still a need to monitor that. We know other things will come out. We know disasters will happen from a public health standpoint. It happens throughout our history, and so we need to be prepared for that and leverage these types of technologies for the next use case as it starts to happen. So with that, I'm just gonna flip through the slides real quick. I know Robbie likes this one because it's very technical. I probably can't tell you other than I know what a CSV file is, how it moves through the system, but the idea was our technologists, the people on the ground, found really creative solutions to make this work happen. So I'm going to leave this slide up, and I want to transition to the people you should be hearing from, and less of me, which is about how this worked and what happened. So I kind of want to start out with the theme of partnership, and I'm going to share it, and I'll start with you. And I'd love you to just tell the audience what it was like to start working with the Department of Health IT team with your Microsoft research team. Like, what was that like?
I mean, for me personally, and I would say also for Microsoft, this was a pretty amazing experience. For me, it was my first foray into public health. I'm in Microsoft Research. I work across a lot of things, but I didn't work in health at all until COVID. In my role, what I do is strategic alliances, strategic partnerships, and technical program management, but healthcare wasn't really a place where I was focused. I was in other areas. With COVID, I, along with everyone else, just got pushed right into everything having to do with health, having to do with public health. And as we started to work on the dashboards and the WA Notify, WA Verify, all of the various projects that we did with Microsoft Research and Washington DOH, one of the first things that was incredibly important, and it was a great lesson for me, and a lesson I'll never forget, was how important community is and how much emphasis the Washington DOH puts on community first, like the people that are going to be impacted by these systems, the people that are being helped by these systems, that may be saved by these systems. That was something that was front and center for us. Even down to the little details. For example, when Brian talked a bit about WA Verify and the, how many languages? 42 languages, was it?
47.
47 languages. So Washington was one of our first, but not our first state to be working on WA Verify. But they were the first one to come to the table with all of these language models. And so this sense of community, like our community is a diverse community with a lot of different language needs, and we need to be able to serve that. But they didn't stop there. So the next thing that was very, very impressive to me was we're doing something really good for Washington, but we're not going to stop at Washington. We're actually going to share things like these language models and every other thing that you guys did with other states. And so any investment, for example, that came into Washington was actually parlayed into a greater good for the United States. Every state that Washington could work with, to collaborate with, to bring these tools to the other states, Washington was right there doing it. So I don't know how many calls I was on where you were talking with other states, red states, blue states, purple states, every state, international organizations, how can we help there? And it was just really the level of generosity and the level of work that you did, not for your own constituency, which was Washingtonian. And as a Washingtonian, I was deeply grateful and deeply proud of that work. But as an American, I was deeply grateful and deeply proud of that work because I knew that it wasn't stopping here, and the work that was being done was actually saving real people. And so that was incredible for me. And then I think the last thing from a partnership standpoint was how close you brought us as industry, how generous you were to us in terms of sharing your knowledge, sharing your expertise, sharing your needs, being incredibly transparent with this is what we need from a technical standpoint. This is what we need from a resourcing standpoint. I know when we were doing the soft launch for Verify, and really trying to make sure that this system did not fall over in the first 2 hours that it was being used. I sat on night after night of like red team calls, so deep in the night, 2, 3 o'clock in the morning, where we're going through things, where we're testing things, where we have teams, from all over the place that were working to make sure that this worked. For me to be invited into those calls, so to be a trusted kind of relationship there, and where I could then bring in the other folks from Microsoft that really also needed to help, that was so special to me. I learned a ton. I felt useful, but I also felt educated, and it was just, so the partnership was just fantastic. And what it ended with was this great, I think, trust and understanding between us, and this real desire to do more and to go further. So that's what it was like to partner with Washington.
Thank you so much. And I want to add, because Bryant didn't mention it about the Verify, I had been one piece of advice I'd been given in my career is never show up on the front page of any newspaper. We showed up on the front page of the newspaper, but thankfully it was a very positive article from the Seattle Times about the work we're doing. So I still don't want to show up on any front pages again, but I'll credit Bryant and the team and MITRE specifically for helping us make sure we did that in a very standard way, so that we didn't end up in a very negative way on the paper. So Ravi, I'd like to kind of hear from your perspective. You deal a lot with the technical side, and you obviously worked really closely with the Microsoft technical team when we were doing this work on Y Health. Can you talk about from the technical perspective, from you and your team, what it was like engaging with Microsoft?
When the app was kind of first envisioned, Microsoft came forward and volunteered to help in setting up the application, kind of doing the basic training to DOH developers and handing it over to DOH, and it was done based on the urgency of the situation. It was done in a rapid pace, and I think we at DOH are very much thankful to Microsoft Research and to Microsoft for that. So it was the Y Health was a low-code platform, and it was kind of like something that could be brought together very quickly compared to very kind of technically coded and kind of and with a complex design. But it is still, even though it is a low-code system, it still has a complexity in it, and has the capacity to handle a lot of workload. So it is a very robust system that has been put in place by Microsoft, and our technical team from there took it on to develop additional components in there, and still working to maintain and do additional development in the application. So it was, that is one, and we are still working on to kind of like that. Since the application, when it was initially built, there was a vacuum for identifying all the logistic locations, and it was something that was helping the decision makers to look into and help in making the decisions to kind of move the logistics around the state based on the need in the hospitals and in the counties. There was a different, there is still a different system called WATRAC, and it is kind of complementing to WA Health right now. And in the future, we are thinking of kind of moving and merging them together and also automating the process, since it is right now a manual process of entering the data and kind of everything brought together manually and displayed in the dashboard that are available right now. But in the future, the plan is mainly to automate the inputting of the data as well, because that is of foremost importance, because if we just leave it like that right now, because people might feel that, I mean, since the pandemic is over, we don't need to have a daily update of logistics per se, but if there's another situation, if there's another pandemic or another epidemic or another emergency situation, there would be a need of the system. And again, if we don't use it right now, everybody will start scrambling, and bringing together a similar system would take time and effort to bring it to up and running. So I think it is very important that we automate that. We kind of like not have the human resources put too much effort into that right now, but just keep it going, keep the lights on, so that when there's a need, it can be brought into action quickly.
That makes sense, and I think, you know, mentioning the fact that it was an MVP, and personally, I hate the name. I think MVP, I picked the person that won the MVP for the World Series, or these are not that, right? It's the minimal viable product we can get out the door to get to community to start making an impact. There's still an investment post that impact that needs to be made. I know you have FHIR up on your FHIR servers listed there on your diagram. We've heard FHIR mentioned here today. Talk a little bit, not about what FHIR is and how it works, but how do we get our workforce ready to embrace the next technology? I know our Apple team over there, certainly they have it, they have that expertise. It hasn't filtered into the public health sphere yet. There's still not quite the talent there, and I'd love to hear from both the Microsoft side and from our own technical team side. How do we invest today in the workforce to make sure they're ready for FHIR and what we need to do next?
There was a discussion at length before this, and I think just to add to that, right now FHIR is at this stage where we know that technology can be used, and it is very useful. FHIR APIs are the way of the future, and everything that we want to make interoperable needs to be done with FHIR-based APIs. But at this stage, we know how FHIR works, how the RESTful interfaces work, but the industry is developing the implementation guides for the use cases, different use cases, and mostly the focus has been in the healthcare side. Now it's moving more into the public health domain. We have a public health FHIR accelerator called Helios, and it has multiple use cases being developed, and implementation guides are being kind of put together. If there are any implementation guides that are missing or that needs to be kind of developed in FHIR, or if there is a CDA or another version of HL7 that needs to be translated to FHIR based on this paradigm. So, the current work is the development of implementation guide, and the next phase will be, or it's kind of like, I think it's mixed together with testing and implementation. So developing of the implementation guides, testing of those implementation guides, and putting them into practice, or putting them in implementation in the Department of Health and also in the healthcare domain would be the next thing to do. And for the workforce part, I think it's a very important aspect of the pandemic that we had the informaticians missing, not really missing, but shortage of informaticians in the system. We have a lot of epidemiologists, we have a lot of programmers, but informaticians is I think it's a mixed breed or a hybrid of of the two that needs to be there to look at both the sides and be able to kind of coordinate between them, and also kind of like be a bridge between the two sectors. So I think that would slowly fulfill the gap that School of Public Health and all the different public schools in the country are focusing on.
Great. Sheridan, you think on how to help us keep that workforce moving? As you know, we're not early adopters usually. We tend to be, no offense to our public health people, we just tend to be, yeah, and the pandemic has shifted that, and I think I'd be interested in your thoughts about how to keep that momentum, about being early adopters and working with a company like Microsoft to keep that going.
Well, first, I think it's incredibly helpful to invite us into these kinds of forums. So, for example, Geraldine Miller, a thought leader, she is one of the people that actually brought FHIR to Microsoft, is responsible for driving some of that forward. I think it's amazing to have Geraldine sitting here and hearing more about this work and being involved more in this work. I think the contributions that Josh Mandel at Microsoft is doing within HL7 and the FHIR work groups, that's so incredibly important. And then people like Bryant being equally very involved there and sharing that information, sharing not just the tech, but on the ground, what are these use case scenarios? What's needed? Not just from Geraldine said it really, really well earlier. It's not the technical side of it, but the implementation side of it. How is it truly useful? How we can move this forward? And I think that just this cross-pollination between industry, between the public partnerships, between academia, all these things coming together, that we just have to find spaces for that to continue, because that's how we learn from each other, and then together we build what needs to be built in order to move things forward.
Yeah, thank you for that. And speaking about moving things forward, we're getting close to the end, and I want to hear questions from the audience. So do we have any questions for Ravi or Sheridan? You've dazzled them with your brilliance, and no one has a question. So let me take a step back and say, I think one of the things that was, oh, okay. Thank you, Bill.
Well, I have a question for Ravi on WA Health, or actually for all of you, on WA Health and the idea of routine use. Like, I think, it's clear that routine use of systems that are used in emergencies is a good idea, but I kind of, been thinking about Geraldine and Brian's earlier comments about kind of the killer app, the critical use case, the compelling reason. And so I'm just curious, how do we take scalable supply and demand systems and what's the use, how do we drive those? How do we identify the kind of problem that will really make healthcare organizations want to report through WA Health on a routine basis?
I don't know if either one of you have thought, Robbie?
Sorry, Bill. So how to make the healthcare organizations want to report to WA Health?
Yeah, how to do what you suggested. How to make WA Health compelling to use in routine situations. How do we deliver value to the people who interact?
Got it. So I think one thing that the healthcare organizations experienced during the pandemic is that they had a lot of caseloads, and at the same time they had to do the administrative reportings as well. And the resources that could be utilized for the pandemic response on the healthcare side was distributed towards administrative reporting. So this is something we could automate, and the healthcare organizations, they just need to expose the API, and when the technology is robust enough to go get the data out of their system and do the computation and report it to public health, which is the work that is being done by a track in Helios Accelerator. And after that is done, I think healthcare organizations will realize the value of that technology or the system, so that they will be kind of interested in using technology.
Yeah, I think everything from just more efficient use of resources in the most normal of times to things outside of pandemics where you have critical surges. So whether you're having earthquakes or you're having wildfires or whatever that causes a surge within healthcare systems, it's goodness to have more information and have that information shared more broadly. And it's something that we should be striving, working towards, and not saying, oh, well, like, oh, it was great in a pandemic, but we'll just go back to inefficient business as usual or less efficient business as usual. I think that we can continue to build upon what was achieved in a very difficult time, but apply that to all of the times ahead of us that will also be difficult.
Yeah, and just to close out, I would say, one, we have built trust, and I think trust is what gets people to the table to have conversations. I think two is public health needs to learn to speak the language of private partners, especially hospital systems, and what drives their business and how they make decisions, so that we can show them the efficiencies of what we can help take out of the system for them that lets them run their profitable model as a hospital system, which mainly keeps people out of the ER. So public health is preventative, right? We don't want people showing up with the flu or with COVID or you name the illness or the fall that hits them on the bottom line depending on their payer mix, but we don't often talk about return on investment in public health, and I think having that true, honest conversation with a trusted partner is the way to start breaking down those barriers from my perspective. So I think I stand between you and lunch, so I'm going to step aside and give it back to Joe.